Hajj is the Muslim pilgrimage to Mecca, Saudi Arabia. It attracts about 2 million pilgrims to the kingdom each year. They come from all over the world, about 180 different countries. And when we talk about or we think about Hajj health, we have to think about the Hajj context. Quite a large proportion of pilgrims are elderly. About 2/3 of those have underlying health conditions. 66% of pilgrims come from low and middle income countries, many from rural areas. And even the characteristics of the population of origin is very important because that's reflected in the pilgrims themselves. So many pilgrims have never seen, for example, a toilet, let alone used one before. Also, diversity is very important. Pilgrims come from all over the world, ethnic diversity, different cultures, way of thinking, behaviors, as well as they come from different health systems. They have different immunization profiles and socioeconomic profiles as well. And that becomes more challenging as well as far as public health is concerned. Additionally, most pilgrims are very enthusiastic to do Hajj, and actually some of them would prefer to die doing Hajj. And that's very problematic when your job is to actually ensure health and well-being of the pilgrims. So changing that mindset is very important. In addition, it's quite a political event. It's under media scrutiny 24 hours a day, so it makes things a little more challenging as well. This slide is not my slide, but I do like it. And it gives, it's really important to give a bit of an overview of what Hajj is and other mass gatherings that are similar, maybe with larger numbers. I think you're going quite faster than it should be, but anyway. If you're a teacher and I would ask you which class would you rather teach, a 10-student class or a 100-student class, most people will go for a 10-student class because it's smaller, easier to manage. But if I add all these characteristics as well to the equation, most people would go with the 100-student class because it's actually much easier to manage. And when we think about public health in Hajj, it's kind of the same thing. The diversity is very important and is challenging. Health risks at Hajj are quite well characterized, infectious diseases and non-communicable diseases. Probably infectious diseases are more of an issue from a global health security perspective, but actually the biggest burdens of mortality and morbidity during Hajj are from non-communicable diseases like cardiovascular diseases. There are other issues as well, for example, heat-related illnesses, especially the Hajj now is going into the hot season, as well as accidents and events related to crowds and crowd management. The Hajj is a journey, actually, especially when we're thinking about health during Hajj. It becomes before Hajj, it starts before Hajj, and then during Hajj and post-Hajj. So there's a lot of activities pre-Hajj that take place, including, for example, a risk assessment of Hajj, which the center actually at the moment does regularly every year, and an update of the Hajj health requirements for pilgrims. These are updated every year as well. And the implementation of these regulations, including vaccinations, for example, for local pilgrims and the outside pilgrims as well. In addition to that, there's other interventions that take place, including the update of various emergency plans and infection control guidelines and so on that needs to be updated. This is just a slide about the large number that we're talking about in terms of vaccination. These are vaccinations of pilgrims, external pilgrims, both in their country of origin, but also at points of entry, because sometimes at point of entry, pilgrims need to be given vaccinations or chemoprophylaxis for certain pilgrims, for example, from the meningitis belt. But vaccination is not just for the external pilgrims, but also the internal pilgrims, as well as the local community and the workforce that works in Hajj, not only health workers, but all the workforce, such as security forces. So we try to get the vaccination numbers even higher than what they are at the moment, especially for meningococcal disease and influenza. And there is the risk communication and health information that needs to be exchanged within the country, but also with the countries of origins. And health, the medical missions of pilgrims are very important in this phase. In terms of delivering care, a lot of the healthcare facilities have to be prepared for the pilgrims. And there are 16 hospitals in the two holy cities, Mecca and Medina, and I think about 34 primary healthcare centers. But in the holy sites, which is Mina and Arafah, where the Hajj take place, there are 8 hospitals. These are temporary hospitals, fully functional hospitals that only work about a week to a day, a year, to accommodate pilgrims, as well as a quite large number of PHCs and clinics at points of entry as well to give healthcare to pilgrims. There's a large workforce, healthcare workers that are deployed from all over the kingdom, about 26,000 a year to give healthcare to pilgrims, as well as other preparations such as preparing consumables and preparing these hospitals to accommodate pilgrims once they come in. In addition to that, there's a lot of training and drills that take place both for the workforce, but also a very large number of volunteers that volunteer to actually work in Hajj. And they need training and orientation, etc. So there's quite a large operation as far as preparing these workers. During Hajj, the activities that take place include both curative and preventive measures. And those are not just for pilgrims, but also for the local community as well as people who are working in Hajj. And this is something that a lot of people sometimes oversee, and they think that it's just for pilgrims, but there's a large number of people in the community and workforce that needs these kind of interventions. I've already mentioned the workforce as far as healthcare workers is concerned. We are at the moment at 26,000, about 13,000 are core healthcare workers, doctors and nurses. And among these, there's public health teams as well. A very large number of these are positioned at points of entry as well as the healthcare facilities. And their job is to ensure that the public health activities are taking place during Hajj. And they start by the first time the pilgrim actually arrived to the kingdom. They are there to check their vaccination card, to make sure that they are vaccinated, to give them chemoprophylaxis or vaccination if they're not vaccinated, also to screen pilgrims for any signs of infectious diseases so they can be actually processed and isolated. In addition to that, they do monitor various things as far as public health is concerned, like water and food quality, vector-borne disease controls, as well as they are involved in health education of pilgrims. They are also involved in surveillance, active surveillance of infectious diseases, and these are the top priorities on notifiable infectious diseases. The list changes depending on the year and what's happening around the world, but most of these are regular concerns that needs to be reported. There's a large number of teams, again, positioned at points of entries, healthcare facilities, mobile and fixed teams that do active surveillance for these kind of infections to make sure that they are reported quickly to the higher authority. Next slide, please. And this is the reporting line. So from medical mission perspectives, primary healthcare facilities, all of these feed into a central team under the command and control center, which are then reported to the higher authorities within the Ministry of Health. The curative services are also important during Hajj. And I already mentioned the hospitals and healthcare facilities that are used during the event. There's more than 5,000 beds and more than 500 ICU beds that are available, both in the 8 hospitals that are available in Mecca and also in the 8 temporary hospitals that are only working during the Hajj, about a week to 1 day. And they provide different services. These, I think, numbers from 2016 Hajj, more than 300,000 visits to primary health care facilities, more than 80,000 outpatient visits. And these are actually, even if you compare them to other mass gatherings, they're really quite high compared to other mass gatherings. In addition to thousands of pilgrims being hospitalized and thousands of kidney dialysis sessions and even quite advanced healthcare, for example, open heart surgeries and so on. And all these are done obviously free of charge. So there's quite a big burden here, and prevention is very important to make sure that pilgrims don't actually need these services in the first place. So this is very important, prevention. Post-Hajj, there's a number of things that happen post-Hajj, especially debriefing, trying to make sure that things, to go over what went well and the challenges and how to improve things. And that's not just from the Ministry of Health perspective, but also other stakeholders in Hajj. And more recently, exporting the experience became quite important, especially with the involvement with the WHO collaborative centers in terms of conferences, consultation meetings, and also in terms of research. Just looking forward, there's a vision of the Kingdom 2030, and one of its aspects is to actually accommodate 30 million Umrah visitors by 2030 and 5 million Hajj pilgrims. And these are really very big numbers, and therefore work to make sure that the Kingdom can actually accommodate these pilgrims, and the Hajj journey or Umrah journey is a pleasant and healthy one, needs to start actually from now. This is especially important looking at some of the challenges in the future in terms of the Muslim population, the elderly population is becoming older, and there are certain other quite important challenges that we need to look forward to. Now, I'll go very quickly over this. The Global Center for Mass Gathering Medicine, where I'm from, is its origin goes back to 2010 at the first International Conference on Mass Gathering Medicine that took place in Jeddah, where the Jeddah Declaration was adopted to create a Global Center for Mass Gathering Medicine in the Kingdom of Saudi Arabia. The center from 2010 up to 2015 was more of a virtual entity, but it did actually get a collaborative, it became a collaborative center with WHO on mass gathering medicine during this time. After 2015, the center became an actual physical entity with its own budget and own offices under the Ministry of Health. And it's been active in various aspects of research, training, and education in mass gathering with health, as well as national and international collaborations to explore the Kingdom's experience in managing the Hajj to the international community. I thank you very much for listening.